Thank you for joining us again on TVC Breakfast. As hinted before we took that short breather, it's time now to talk health, and our focus this morning is on the prevention and management of stroke disease. There's been so many analyses on this burden, so to speak, this health burden, which many people bear, not just in Nigeria, but in many parts of Africa and even the world. Well, strokes, analysts say, health experts say, are a life-threatening emergency, and immediate attention is critical to preventing permanent damage. Well, it's also called a cerebrovascular disease because it affects the blood vessels that feed the brain, and this occurs when there is a decrease or denial of oxygen to the brain. Although many strokes are treatable, some can lead to disability or death, as well as paralysis. And we have joining us in the studio Gloria Ekeng. She's a UK-based stroke nurse consultant and founder of Stroke Care International. And we say a big welcome to you for joining us again, joining us in the studio. You were speaking with us earlier on before we brought you on live, how, this has been a regular tradition for you, annually, where you come to raise more awareness about, the disease stroke. Tell us where we are in spite of and earlier on, of course, you also admitted that October is the month for stroke awareness, so to speak. In terms of the burden that stroke bears, or the burden Nigerians carry in managing stroke, where are we? Is it still a major concern? Is it still a disease that many people don't know much about? What's it like for you from where you stand?
Good morning again, and thank you. Thank you for this great opportunity. Thank you to TVC. And it's been really amazing coming through, even from the gates. It's been a very, very warm welcome. Thank you.
Thank you
so much. Yes, indeed. The rate of incidences of stroke in Nigeria is alarming. Very alarming. And you know why I know? Because of all the referrals that we've got. So Stroke Care International, it's a stroke support organization for stroke survivors. And then I am the chairperson for the whole of Sub-Saharan Africa. So I receive most of the queries about stroke. And the culprit, I would say, that leads to most of the strokes in Nigeria is high blood pressure. High blood pressure. We had a big program yesterday at Ojota, and sitting right there, there were people that had their blood pressure as we were testing them, that's gone off the roof. Like, you're talking about 200 over 100 millimoles of blood pressure, and they're walking about. And a lot of history of people who've had stroke and have had other strokes on stroke. So where we are now is alarming, considering the situation we are in now in the country. People are worried, and so they can't even afford to buy the medication.
So are you saying that the socio-economic factors, or socio-economic factors precisely, also relate to, they have a connection with stroke? Some people will say underlying ailments, one of which you mentioned, the high blood pressure. What leads to high blood pressure itself, and how long does it take for it to get to the level where one will be stroke-stricken?
There are many factors that actually lead to high blood pressure, otherwise known as hypertension. The way we live our lives, the things that we eat, and if we don't modify how we live, the things like alcohol and drug abuse, especially among the young ones. We have young stroke, and then we have adult stroke as well. And blood pressure can also run in families. There could be a family history, which is the reason why people should find out family histories and know if it runs in families, so you can really know how to live your life and plan out your life and check that everything is optimum. And other things also like alcohol abuse, a lot of drinks. People want to, hide their sorrows or the situation, let it pass, and then they drink so much, and that keeps the blood pumping. Other things could be the way we eat, bad oils, cholesterol, things like this, things that can harden the blood vessels and break out and block, the blood flow, which carries oxygen to the brain. So these are not exhaustive, but these are some of the factors that may cause stroke through high blood pressure.
Okay, and of course, so it's basically about managing that hypertension, or
exactly.
bringing down, as much as possible your high blood pressure. Yeah, because that's the indices that, could trigger stroke.
Yes.
And then help us break down, because many people still see, okay, some people, know the symptoms of stroke, but in terms of what goes on inside of the body that, brings about stroke. There's this talk about, blood to the brain, and help us to understand, how the body behaves. It behaves the way it does when,
a stroke happens.
A stroke happens.
Right. There are two types of stroke. There's the hemorrhagic one where the blood vessel just bursts because the pressure is too much and goes into all the vital parts of the brain. That's really pretty dangerous. And then you have the ischemic stroke, which I talked about, where a thrombus, a particle from another part of the body, from a hardened blood vessel, breaks out and travels along with the blood flow, and then causes what we call embolism, and that stops that part of the brain being supplied with blood and nutrients and oxygen. So therefore, this is what happens when a stroke happens. So when it happens, the signs that you will look for, even as a witness, is what we call be fast. Fast. F, you want to see if their face is like normal or asymmetrical or has gone to one side. A, you want to ask them to stretch their arms out and see if it's okay, balancing, or if it's one is falling down. You know that something is not right. And then S, speech. Are they speaking properly, or is it slurred speech, or they cannot get the words out? And then T is that time to call your provider or to go to a hospital. But I think that it is very difficult. In what I've noticed here in our country is that it is very difficult to say call this number. For many reasons, either the ambulance, it's not there, or there's a traffic. There's so many things that we have to, take into consideration. But what I want to stress actually now is that time is brain. That's what we say. The earlier you get to the hospital, the earlier you get help, then the better you'll be in terms of making that recovery. Right. Because
you've expressed worry about people having access to emergencies, medical care very quickly. But what do you think are the immediate steps that one can do what moments you suspect that, what is wrong with such individual is stroke, either individually or what people around the person can do in the interim?
This is why we try to create awareness. But I tell you, whatever we do is a drop in the ocean. We need more and more, not just once, twice a year, because our people think that stroke is this. We try to bust the myth within the stroke, because people think that when you have a stroke, somebody from the village done something, and people have all this myth about stroke and make it a thing that, we can't tell somebody because I think that there's something evil, somebody in the family, which is not true. And the first thing they do is either to call their religious leader. It's a good thing to pray and not what you do, but I think that the first step is to try and get medical help, because the sooner you get this help, the better. Because once you get into a facility that has those things that you need to do a CT scan, you need to do ECG to see if it's from the heart, you need to do MRI, and the blood, stroke-specific blood test to see if there's a problem with your clotting factor. All those things could be done straight in a hospital that deals with stroke. There are stroke-specific hospitals even here in Lagos. So if you're a witness that somebody's having a stroke, I think the first thing is to rush them to have to be checked out. And if it's within the window of 3.5 to 4 hours, they stand even up to 6 hours. They stand a very great chance of a quick recovery.
Oh wow! So those first few hours are
very crucial.
Very crucial.
Very crucial.
But then the reality in Nigeria, as you have said, is that these hours are usually lost.
Yes.
Right.
Yes.
You also spoke about stroke upon stroke earlier on. You said because people would also need some more clarity on that. So you are saying that there could be several episodes of stroke. Help us understand.
Definitely. Once a stroke happens, we need to have the diagnosis, what actually caused the stroke in the first place. And once that is been established, we need to treat that underlying cause. Because research has shown that once somebody has a stroke, the possibility of having another stroke 1 week after, 3 months after, 5 years after, it's there, it's possible. I have seen people, they say, a case that's been referred to me 2 weeks ago since I've been in Nigeria, and then the elderly man had a stroke 5 years after, had another. So he's had 3 strokes, and the third one that he's had now has actually rendered him unable to move, loss of mobility, loss of speech. He's had on both sides of the brain, both the left side and the right side. So you can imagine. So the underlying causes of stroke has to be diagnosed and treated optimally to avoid this stroke on stroke.
So are you saying that if one has stroke, it can be treated and one can bounce back from stroke? Does it get to a level where it might be irredeemable to save such person?
I want to stress that there is life after stroke. We cannot give up on people, but it's work in progress. It's a long-term condition, so it needs to be followed through. It's management. We want to term it management because not treatment, because stroke can be well managed.
So once you have it, you just have to keep managing.
Yeah, it depends on the severity of the stroke. Some strokes, like mini strokes like TIA, are just a warning sign that there's something not right. So you should find out what's not right, because that comes momentarily and disappears, and you think, oh wow, I'm all right now.
What's the symptom of that?
It's TIA. Well, a TIA can be, somebody shopping, and then you're pulling your trolley, and suddenly you feel some arm and leg thing, one side, it's weak, and then you start to stretch it or something. Few minutes is gone. And then the other symptom or sign, it's that you're looking at something and as if there's a black curtain coming down, and you start to blink or rub your eyes. And oh wow, there's something there, but now feels better.
Like there's a black something.
Yeah, a black curtain coming down, and obscures your vision for just few seconds. And as you rub your eye, you say, oh, it feels better. But those things, we should not just leave them. We should follow through and go to your health provider and check out your vital signs and see that everything is good that way.
Oh, all right. And okay, so I want to also understand the recovery process. Of course, as we said earlier on, there's the disability dimension to stroke.
Yes.
There's also of course, tied to that is paralysis and death. So walk us through these stages and how one can prevent them. I've heard someone say the first 6 months, of management, are crucial. There are people who die within this period. But then we see people who are being managed. I know someone who is in his 80s and for more than 30 years or thereabouts, he has been managed for stroke.
It's possible. That's why I started by saying that there's life after stroke, and that's what we want to hear. Once a person has a stroke, the management, rehabilitation, management in terms of regular checkups of whatever was the cause, and the regular medication is one part of the management. The other one is rehabilitation, depending on the severity of the disability. It's the work of therapists, like physiotherapists. And you know, in Nigeria here, I think the ratio of therapists to patient is alarming. We had a physiotherapist yesterday, and he said that he is alarmed. He couldn't take any more work because it's so much. And he looked at it and said, well, I had opportunity to go wherever to go and work outside in diaspora. The money is good. But when he thinks of the people that he needs to help here, he said he couldn't do it. He had to cancel that. So therapy is very important. And speech therapists are just not so many here in this region, because we need the speech therapists to see patients who have had aphasia, speech problems after that. Because like in the case of the old gentleman that I've just discussed with you, he had the stroke on that side, and then he lost his speech. But then people were not sure. There was no proper investigation and assessment by the speech therapist. So they started giving him things they shouldn't, and it goes down the wrong way. And that's a huge problem when people aspirate like that. So these are all the things that we have to look at. But it's an ongoing process, and it also depends.
Those who gave the person, those medications, were they professionals? Were they medical professionals?
Yeah. They are.
Is that to say that
they need training?
People, medical professionals who can tackle the problem of stroke effectively.
Well, I think that what we started a couple of years back in Nigeria with some neurologists. I think that just two of us have got a nursing background from UK, and others are professors in this country, well qualified. We started African Stroke Organization, but most of the practitioners are not joining this organization so that their practices can be regulated, so that they know what is going on. Because I've had stories of here everybody just that can afford starts their hospital. I'm not sure how far they are being regulated, because people have been taken from, when a stroke happens, they're rushing somebody to one hospital. Oh, well, yes, we cannot do it. Then they'll be moving them around hospital, and then the valuable time is being lost. Or they've been admitted, and all what they do is give them fluid, and they have not started any form of investigation. Do you understand? Or assessment. So time is lost, and then people just get the worst treatment whatsoever.
We've run out of time, but I just wanted to briefly touch on a few seconds on the fact that this is not just a disease associated with old people, because there are statistics that we see now that say even young people, and is it children now,
exactly,
are also at risk.
Stroke can happen to young people, children, adults, but predominantly people over 65, but there are young strokes, very, very young strokes, teenage strokes. We talked about alcohol and drug abuse, and that's among
those are the triggers. Oh, all right. Gloria Ekeng, UK-based stroke nurse consultant and founder of Stroke Care International. We thank you very much for speaking with us, and thank you for your work. And we hope that you continue to make more impact.
Thank you so much. Thank you.